Welcome to the 2.0 conference.
Well, thank you.
You're welcome. It's a pleasure to have you here. Can you go ahead and start off by introducing your first and last name and the organization you're with?
Absolutely. I'm Dr. Dale C. Holly. I'm a board certified gastroenterologist with United Digestive in Atlanta, Georgia. We're a large single specialty group in Atlanta.
Perfect. And you are a Health 2.0 conference honoree. How did it feel to receive recognition for your accomplishments?
It was fantastic. I mean, it's from a young man growing up in the South in Arkansas, moving through the educational ranks, finding success academically. It's been really rewarding, and basically culminating with me getting my master's last year at Dartmouth College and of the master's in healthcare delivery science. Really kind of piqued my interest in healthcare delivery and how broken the system is in this country and what we need to do to try to rectify some of these issues.
Correct. Okay. Now, what advice would you have for somebody that wants to follow in your footsteps?
I think the most important thing is just having a purpose, have some objectives that you want to achieve. I think confidence is really important. Believe in yourself, believe in your mission. And I think once you do that, ethically, if you know that you're on the right side, you're telling the truth, you're trying to do what is right in society, I think those are the most important things, are moral values, ethical behavior, having a purpose and being driven.
Perfect. Well, thank you so much for that advice. Now, how has your learning and networking experience been so far at the Health 2.0 conference?
It's been incredible. I mean, I've met a lot of really interesting people from various backgrounds. Healthcare is really complex. It's going to require a collaborative effort, looking at a lot of different entities within the healthcare ecosystem. So just trying to meet as many people as I can to learn and grow, to try to be able to apply these principles so I can actually make healthcare a better space as well.
Perfect. All right. Now, where can others reach you for continuing to collaborate or receive advice from you?
Absolutely. I'm on LinkedIn, so you basically go to my LinkedIn page, Dale C. Holly MD. You can find me there. Also, you can catch me or connect with me at my practice at UnitedDigestiveHealthcare.com and just search for my name under the webpage there.
Perfect. Well, thank you so much. Now we have that. And I have another question. Do we have a moral obligation to provide healthcare to everyone as is needed, or is healthcare a commodity that should be subject to the same marketplace influences as other commodities?
I really think this is the critical question of today. If you think about healthcare, you can look at it in two different terms. Is healthcare right now, is it a right? It is not. It is right now, it's a privilege, and I think that needs to change. So I think healthcare should be a right in this country. I think it's critical. I think when you look at the framers of the Constitution, they basically drafted a Constitution that said we all have certainly inalienable rights, that being life, liberty, and the pursuit of happiness. I believe you cannot pursue those things, life, liberty, and pursuit of happiness, without good health. So I think it's a right for every individual on the planet to have access to health care. It makes us better as a people, it makes us better as a country, it makes us better as a planet.
I most definitely agree, and it is the sad truth that we live in, sadly, but let's hope that we can fix that.
Absolutely.
Now, my last question for you is, what should the government's role be in providing access to healthcare for Americans? Can you go ahead and keep elaborating?
I think that's a great question. I really believe healthcare is one of those complex entities that requires, I think, a very comprehensive approach. I don't think you can take it from, say, just the public sector or even from the private sector. I think you need both. I think that in most healthcare systems, it gets really complicated, particularly in a system like America, where you have 300 plus million individuals with a lot of complexities and chronic illnesses. So I think the government should have a role, and it already has a role. If you look at it, Medicare and Medicaid are government-run programs that actually work. We just need to retweak and refine those programs to allow them to better serve the constituents in this country. So I think government definitely has a major role in healthcare and how we advance it going forward.
Perfect. Well, thank you so much for being here, and it was a pleasure. And again, congratulations for all your recognition, and we hope to see you come back, okay?
Likewise. Thank you so much. I appreciate your time.